Hi, I'm Dahl, and I'm the occupational therapist here at Wieber Physical Therapy. Today I'm going to talk to you a little bit about decreasing tightness and pain into the hand, wrist, and fingers. Oftentimes, because of the activities we do, we can start to become stiff and tight, and there's good reason for experiencing that. A lot of our activities that we do are repetitive in nature, that the hand is the piece of the anatomy that we hold on to objects with. It doesn't matter if it's a computer mouse or our laptop computer or tools, hands, babies, things that we're holding on to. Over time, things start to get stiff and tight. So today we're going to show 3 simple ways that we can go through and loosen up some of that tightness, keep our joints moving well, keep the fascia hydrated, and keep the muscles and tendons at their nice, soft, resting length. Over here we can see we have an anatomy poster, and the hand is pretty intricate. It has a lot of internal muscles here, and as we look at the thumb is 50% of the hand. So there's some muscles that are right in here that we would see on our palm, also on the small finger side, and then deeply in between the bones we have our hand intrinsic muscles. On top of that we have the tendons, the muscles, and even at the deeper layer, we have ligaments. And the thing that's important to remember about the hand is just from the wrist out to the fingertips, there's 23 joints. So if you're wondering why sometimes your hands feel a little stiff and tight, it's for good reason. There's lots of joints, which require lots of ligaments and fascia to hold it stable and still. And over time, those like to get a little tight as well. So what do we do to work with that? Everyone that works in an office setting or uses their hands a lot during the day should invest in one of these smaller, what we call myofascial release balls. They are wonderful, and so that's the routine that we're going to go through here, just to give you a quick demo on what you can do to help that feel better. So the first thing I like to do or encourage people to do is just kind of do a quick assessment of what their range of motion is like, and I have them just put their arms together like this, bend their wrists back, and of course looking at their range of motion. Now, to a trained eye, I can see I actually have some tightness in my thumbs. So that means I'm going to want to go into this thenar eminence a little bit more. But for all of you, just a quick assessment, kind of sense and feel where you're noticing some tightness or tension. And then we can go into it with using these balls. We have a link either to our website or on our Facebook page where you can buy some of these myofascial release balls. They're about $7.50 a piece. They're soft. You can use them also on other body parts. So if you invest in this program for your hands, you can also use it on your feet, on your upper neck and back, but that's another story. So today we'll go through that. So the first thing we're going to do is just kind of loosen the hand by doing some gentle pumping and squeezing with the hand. Fingers are coming in. We're just starting to get these to open and squeeze down, and so we're actually pumping some fluids through the hand. Stagnation happens a lot when we use our hand to hold things, so if we can just open and squeeze, we start to get some of the pumping going. And then we're going to go to some key areas. We're going to hit all along these metacarpals here, onto the base of the thumb, and then over onto these muscles. So on your desktop or anything that gives you a firm surface, you can start over on the base of the hand and just giving a light compression onto the thumb, base of the thumb, then rolling over right to the middle of the wrist, and then over onto the side of the hand, and then addressing the small finger, the ring finger, the middle finger, and the index finger, and then going back again. So we're starting with this kind of point pressing and contractions all along these whole areas. The next thing we're going to start to do is a glide. So you're literally kind of massaging out this area that we just went over with some of the point pressing. So again, point press all the way through along the sides and along the metacarpals, each finger, and also at the base of the thumb. And then gliding. It's almost like you're making a U shape, landing in the middle and then along that area. once you get used to doing this for yourself, you're like, dang, this feels so great. You can easily keep this in your desk drawer. It's fantastic. So the next thing then, once you've gone to these pressure points, then you're going to start to do what's called a rinsing motion. So you're going to start at the base of the wrist. You're going to put the ball here and you're going to literally rinse it out from each finger at a time, going all the way down and gliding back to the middle finger and gliding back to the ring finger and gliding, and that little finger and gliding. And you'll get to start to feel what feels the best for you. You can go back to that circular clockwise and then counterclockwise, using your other hand on top to support. And if that's feeling good, you can actually walk that a little bit up the forearm, so that now you're going to get all of the tendons and the muscles that work the fingers. The muscles that actually work the fingers live in the forearm. So we want to get that whole component for functional movement. And if you happen to find a spot that's a little tender in the forearm, you can stop and rest and just toggle over it a little bit and then rinse it out. So if any of you have ever heard of a foam roller that people use on their back or their glutes or their quads, their IT bands, this is the routine for the hand, wrist, and elbow. And of course you would do it for both hands, and then when you're done, it's neat to give yourself a little bit of a quick reassessment. How much more at ease do I feel in my range of motion? So there you have it, your quick fix to hand, wrist, and finger tightness using the myofascial release ball. And if you have more questions, you can contact us at Wieber Physical Therapy, and we'd be happy to help you with any of your questions.